The rise of the technology and advancement of machineries nowadays gives positive advantage to the food manufacturing industries in terms of rapid and consistent production processes. The use of this machinery lessens the burdens of the worker since machinery takes over the job. But, in contrary to that, the products are not 100% free from contaminants and other toxic substances invasions. Canned products may look secured, but little did we know some of these products are contaminated with harmful organisms such as bacteria, viruses, fungi, and more. Do you sometimes feel stomach ache after eating? Or the needs to vomit, diarrhea, fever, and dizziness? These are some of the symptoms of foodborne diseases. Foodborne diseases are diseases that is caused by taking in contaminated foods. Well, good thing is, most of these diseases can be treated, but in some serious and critical cases, it is very risky and sometimes leads to death. That is why it is very important to know the nature, the possible occurrence, and mitigations of foodborne diseases to prevent the harmful effects. So in this short video, we're going to show you about the 3 most common foodborne diseases and their mitigations. We're going to explain about shigellosis, salmonellosis, and anisakis simplex.
Foodborne disease are infections caused by a variety of bacteria, viruses, and parasites. There are many different types of foodborne disease. One of those different types of foodborne disease is the shigellosis. The causative agent of this foodborne disease is Shigella. Shigella is a gram-negative bacilli. Transmission of this disease occurs through direct or indirect contact with feces of infected persons, in which humans are the primarily reservoir or sources of this disease. Foods can become contaminated during handling or preparation by an infected food handler. In case in fisheries commodities, specifically the seafoods, contamination can occur if seafood is harvested from sewage-contaminated water, as occurred in outbreaks caused by consumption of raw oysters harvested from waters, where sewage was dumped overhead from the oyster harvest boat. The symptoms of this fishborne disease including fever, abdominal pain, tenesmus, and bloody diarrhea. The agent of this disease, which is Shigella, can survive outside the house, but they are killed readily or prevented by cooking. Additionally, control strategies to prevent shigellosis associated with seafoods have included monitoring of harvest water for fecal coliforms, prohibition of harvesting from sewage-contaminated areas, and forced control of dumping sewage overboard, and guidelines for seafood handling in restaurants.
Salmonella disease. This salmonella bacteria is an infection that can affect the intestinal tract, and this is usually found inside the humans and animals. And humans can contaminated by eating this contaminated food. Others will develop symptoms with 72 hours of consuming infected food or water. And the other symptoms are fever, chills, headaches, or blood in a stool. And what could be the possibilities or in what way to prevent this salmonella disease? Avoid eating high-risk food or raw meat or lightly cooked eggs, undercooked ground beef. Clean hands and surfaces with soap and warm water before and after preparing foods. Cook foods to a safe internal temperature. If possible, use a meat thermometer. Thank you and good day.
Hi, good day. We know we Filipinos love to eat seafood. Most especially, the recipe that the main ingredients is a raw meat of fish. This is commonly known as kinilaw or kilawin in Tagalog. But what if this seafoods or recipe is served in a poor way? Could there any possibility that it could affect our health? What common foodborne disease we get if we eat this poorly served seafood? And how can we prevent this disease? According to Food and Drug Administration 2012, Anisakis simplex and related worms is one of the most common foodborne disease caused by nematodes. Nematodes are eel-like parasites that can be found in and common in fishes, most especially in their meat. Roundworm or nematodes can affect our body, especially in our stomach, if we ingest raw or lightly cooked seafood. The affected person can feel the worm through their throat, or when it sticks to the stomach, the person can feel stomach ache or abdominal pain, nausea, vomiting, and diarrhea, and sometimes it causes allergic reaction. To prevent infection from this kind of disease, fish should be cooked until the inside stays at 63 degrees Celsius or 145.4 degrees Fahrenheit for at least 15 seconds. Croquettes at 68 degrees Celsius or 154.4 degrees Fahrenheit, and stuffed at 74 degrees Celsius or 165.2 degrees Fahrenheit. No, I'm not saying that we should stop eating kinilaw. What I want to say is make sure that fish is not contain nematodes. Check the fish first and then perform the best way or proper way on how to serve this yummy food. But if you are not sure about it, just cook the fish nicely as what I have said earlier. Thank you.